Today's healthcare provider faces many challenges. The lack of primary, ancillary, and specialty healthcare providers, as well as the geographic distance between healthcare communities, continue to be significant barriers to accessing healthcare services in underserved rural, suburban, and urban areas. Parts of the country have difficulty attracting and retaining healthcare providers, as well as supporting local healthcare facilities to provide a full continuum of healthcare services. In addition, many healthcare providers in medically underserved areas are isolated from mentors, colleagues, and the information resources necessary to support them personally and professionally. These and other challenges centered around convenience, collaboration, continuity, and compliance are at the core of legislative healthcare discussions every day. Renown Health has a solution. Renown Health is proud to announce Renown TeleHealth, a cutting-edge mode of delivering healthcare services and public health utilizing information and communication technologies to enable the diagnosis, consultation, treatment, education, care management, and self-management of patients. Renown TeleHealth provides a variety of services to aid in the challenges healthcare is facing every day. Do your part by learning about these services and help our healthcare system go the distance. So, what is telehealth? According to the American Telemedicine Association, telehealth is formally defined as the use of medical information exchanged from one site to another via electronic communications to improve a patient's clinical health status. Telehealth includes a growing variety of applications and services using two-way video, email, smartphones, wireless tools, and other forms of telecommunications technology. In other words, telehealth is a healthcare option that virtually connects leading providers to patients and providers with the purpose of expanding access to care, improving the health of the populations, improving patient satisfaction, and reducing unnecessary costs. Currently, telehealth services are delivered in 6 environments addressing multiple phases of the care continuum, including virtual disease management, education services, and support groups that patients, families, and caregivers can leverage to gain more control over their acute and chronic conditions from our state-of-the-art telehealth conference centers. Order or refer patients to these in-person or virtual events to increase productivity in your clinic while providing patients with additional resources to take more responsibility for their care and improve the quality of their life. Reach a broader audience to share your expertise and knowledge with CME and CEU opportunities and more. Access advanced learning opportunities without ever having to leave your office. Primary and specialty care through virtual visits. Patients can see a provider without ever leaving their home, place of business, or vacation destination through any video-enabled device. Specialty care through elective scheduled clinic telehealth, utilizing local community telehealth locations to present patients for specialty care with advanced telemedicine equipment and medical peripheral tools. Hospital visits, addressing care from emergency room to emergency room, inpatient beds to hospitalists or specialists, and intensive care units to intensivists. Post-acute and chronic disease management care through remote monitoring for more accessible management of high-risk patients. Nurses monitor patient biometrics through remote devices and are able to contact patients, providers, or even emergency medical services when those biometrics fall out of acceptable range. The Center of Excellence. Patients traveling out of state hundreds or thousands of miles for subspecialty care is minimized by providing virtual consultations with subspecialists. Patients can be presented in their urban community through the Center of Excellence to specialists that provide care that is not offered in the local community. By exploring your participation and use of telehealth as a healthcare service, you have the opportunity to provide quality care for your patients. Some advantages of telehealth for your patients are expedited visits, cost-effectiveness, state-of-the-art care delivery, and access to care. Advantages for primary care physicians are access to an exceptional customer contact center to handle the referral authorization and scheduling duties, access to an information technology team to help support your telehealth equipment, access to a telehealth education in the form of learning modules and educators to train your staff to be excellent telehealth presenters, convenient access and ability to collaborate with specialists, continuity of services when an in-person visit may be required, patient care compliance, and a positive economic impact in your local economy by keeping dollars in your community. Advantages for specialists are care provided to patients that otherwise did not have access to care, access to more patients, high-quality images obtained with the most advanced technology, continuity of care should patients need an in-person visit, ability to collaborate with providers and care teams in other locations without having to travel. Along with these benefits, there are also many community advantages telehealth can offer, such as the overall reduction of healthcare costs, providing specialty health resources in communities that may not have them, more revenue spent in the local economy, and early disease intervention and management. With telehealth technology working for you, your healthcare services will meet the challenges of tomorrow. Thousands of providers across the country are voicing their support of telehealth. Here's what a few have to say in your region.
The advice that I would give others who are just starting out and thinking about providing telemedicine for their patient or telehealth, this is an exciting time to be involved. We have so much opportunity to get what I call, this is my phrase, getting the smartest person in the room for the patient. And if I think that my patients would benefit from a specialist who is maybe 200 miles away, but they have the keys to the diagnosis, I'm going to do whatever I can.
For me, telehealth is added to my practice. It's added to my ability to provide total care to my patient. I've always prided myself that I take care of patients from birth to death because I'm a family practitioner. And now with telehealth, I feel that I can do all of that in my own office, which is exactly what I've always wanted to do. I've just got an army standing beside me now. I don't have just me as the lone soldier going up against, 3,000 problems. I have every kind of a specialty that you can think of.
What I like most about the telehealth experience so far is the access for my patients that they would not normally get without it. There are so many patients that would not be able to make it far distances to see their specialists and get the proper care that they need. And now we're closing those gaps and we're saving them money and saving health care costs. And I think that is one of the most important things.
My favorite part about having telemedicine as my day-to-day job is the interaction I get with patients. That I learn a lot from, sitting in there and listening to specialists.
Also, a great utility for telemedicine is the fact that you could reduce exposure to communicable illnesses. If a patient were having, say, a viral gastroenteritis, conjunctivitis, chicken pox, certain illnesses like that, you can diminish your exposure to other patients in waiting rooms, also to the provider yourself if you can deal with these ailments through telemedicine. So that's a beauty of being able to virtually see your patient.
I really look forward to my telemedicine sessions. I go into it with a full capacity of energy. I don't feel at all burned out when I'm taking care of patients telemedically, and I think that they sense that. I feel kind of a positive energy when I'm engaging patients in these visits. I foresee a time in the future when person-to-person medicine is the exception, and that telemedicine is the rule.
Patients almost universally are very positive in their responses, and I don't think it's just to make the provider on site happy. I think they really have been surprised how positive an experience it was, and have been pleased with the degree of two-way communication that occurs, and if anything, pleased with getting perhaps even more information from the doctor provider, the neurology provider, than they would get in a face-to-face interaction.
We're talking in this country about managing healthcare costs, helping patients burden and improving their experience. Telemedicine is pretty well leveraged to do all of those things. I've had 10 years of experience starting as a medical student. It's pretty hard to maintain the argument that telemedicine is not going to be part of the future. I think physicians tend to be good at adapting. In the last 10 years, we've gone through several EMR systems, probably like all providers have. We hold our nose and do these things because we understand, I think, ultimately that technology and innovation are what's driving healthcare these days. So I wouldn't consider myself as a cardiologist as an advocate, as opposed to saying, boy, when this comes down to the bottom line in retrospective analysis, is this good for patients? Is this saving our common goal? I think the answer has to be yes.
If you'd like to see additional provider comments and personal telehealth experiences, please go to the Resource tab. Telehealth is growing at a rapid pace nationwide. With that growth, there are common misconceptions that have emerged. Perhaps you have heard. Telehealth represents a lower standard of care. Fact. Recently, authors of pending legislation concluded the delivery of healthcare services via telehealth shall not diminish and may enhance the standard of care for healthcare providers and their patients. Telehealth provides a high quality of care while cutting down the travel cost and time usually associated with these visits. Specialties are limited. Fact. More than 30 specialties are participating in telehealth programs. Current telehealth adoption rates are increasing and more programs are becoming available. There are compensation issues with telehealth visits. Fact. Most insurance companies now cover telehealth visits. More than 30 states have adopted telehealth legislation that brings parity between in-person and telehealth services. Telehealth clinic and hospital visits are compensated at the same rate as in-person visits. The technology of each tool is too difficult to use. Fact. Telehealth e-learning programs are now available. The modules provide the opportunity to further learning about telehealth protocols, equipment, and specific tools. I am responsible for organizing telehealth consultations for my patients. Fact. Prior to the visit, a full-service support team is available to address scheduling, documentation, and telehealth protocols. Also, a presenter is available to aid in the telehealth physical examination if necessary. Ongoing training for telehealth presenters is available to continually enhance the patient's telehealth experience. As a physician, I need to physically examine the patient and cannot conduct the visit virtually. Fact. A physical examination is an important piece to the evaluation and management of a patient. Studies have also shown that a thorough medical and social history interview is also key to the decision-making process. With the assistance of trained telehealth presenters, advanced peripheral tools, and quality images, along with the patient's medical history, precise decision-making can still be achieved. Find convenience, collaboration, continuity, and compliance with Renown TeleHealth. For more information, contact the TeleHealth team at 775-982-7700 or send an email to telehealth@renown.org to become a participant of the telehealth team today.